Practicum Script is a set of clinical challenges that take place in complex scenarios built on the clinical histories of real patients. Now, we will explain how the simulator works. This will be the operating menu that can be accessed from any device through the internet. Every week, one or two new cases within your specialty will be presented. Let's start with the case of the day. Check to see whether the case is focused on diagnosis, treatment, or complementary tests. Then, read or listen to the description of the case carefully. The program gives you the option of choosing how to start resolving the case, either by formulating your own hypotheses, or if you cannot think of any, by working directly with the hypotheses proposed by a committee of international experts. Try to start with the hypothesis formulation step. Your first challenge is to formulate up to 3 different hypotheses based on your clinical experience and to indicate the probability of each. The simulator will give you immediate feedback about the level of concordance between your hypotheses and those proposed by the international panel of experts. If the program does not identify any concordance for one or more of your hypotheses, you will be able to defend your position and have it considered by the scientific committee. Next, the simulator will convert the case exposed into a set of key terms. Try to choose up to 3 terms that favor each hypothesis and up to 3 terms that go against each hypothesis. Here, the quick thinking phase ends and the slow thinking, deductive, hypothetical phase begins. Pay attention to the hypotheses selected by the panel of experts that you will work with in this clinical decision-making phase. Assign a probability to the hypotheses that you did not originally consider. The simulator will present different clinical situations for the same case. In each of these scenarios, it will show you a hypothesis and then will add new information about the patient. Your challenge will be to think out what impact the new information will have on the likelihood of the proposed hypothesis and to decide what the best response would be. After confirming your answer, you will immediately be able to see the degree of concordance between your response and those of the members of the committee of experts. In most clinical scenarios, there can be more than one valid opinion. A bar graph will show you the percentage of experts that have chosen each response, together with the arguments and evidence supporting their choices. When the experts do not agree about the decisions for a patient, the Delphi method is applied to try and arrive at a consensus. You can see the successive rounds of answers from the experts before and after facing their scientific arguments. The conclusion of the resolution of the case is a third important point in the simulation. Inductive reasoning centered on verification and corroboration. You can see a general summary of your results regarding both hypothesis formulation and clinical decision-making, and you will be able to review the entire case you have solved. Once the simulation is finished, you will be able to choose to tackle a new case immediately to see your overall results, to consult the indicators of your progress throughout your training, or to go to your portfolio to reflect on your performance for each case that you solved. The simulator will always give you the opportunity to participate in the clinical debate sessions about the case and exchange opinions with colleagues from different countries. If you have any doubts, click on Script Connect. If everything is clear, you can get started with the Practicum Script Clinical Simulator right now and become an active member of our Clinical Reasoning Club. Practicum Script.